Hi, it's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care, so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. In last week's blog, I talked about the top 3 mistakes you are making in family meetings with the intensive care team. You can check out last week's blog by clicking on the link below this video. In this week's blog, I want to talk about what if you could reverse the intensive care team wanting to pull the plug or withdraw treatment on your critically ill loved one. Before I get into today's topic, I want to share a quote with you that I wrote on today's topic, and the quote says, "Nothing sparks more controversy, more emotions and differing views than withdrawal of treatment or withdrawal of life support situations in intensive care." You and your family on the one hand want everything done for your critically ill loved one, and yet you don't know how to go about it, and you don't know how to get the results and outcomes that you want and deserve, especially if you copy the behavior of 99% of the families of critically ill patients in intensive care who make no informed decisions, have no peace of mind, no control, no power, and no influence. You and your family have no idea about what's really happening in intensive care. Especially, you don't know what's happening behind the scenes, and therefore you are unable to position your critically ill loved one's diagnosis, their prognosis, as well as their care and their treatment in a light that gets you the results you want and also deserve, and potentially save your critically ill loved one's life. On the other hand, intensive care teams, with their perceived power and their perceived authority, know all about their hidden agenda, and they know all about how they are going to position your critically ill loved one's diagnosis, their prognosis, as well as their care and their treatment in a light that enables them to withdraw treatment, withdraw or limit life support, and or issue a DNR, do not resuscitate, or an NFR, not for resuscitation order, without you and your family being able to challenge or reverse it. Getting results and outcomes that you want in intensive care, especially if your critically ill loved one is in a situation where the intensive care team wants to withdraw treatment or limit or withdraw life support, is not as difficult as it seems, especially if you follow expert advice from someone who knows intensive care inside out and who knows the dynamics, the politics, the psychology, and the intrigue on an intimate level. So, let's get into today's topic. I receive a lot of phone calls and emails from distressed families of critically ill patients in intensive care, where they feel pressured to agree to a withdrawal of treatment, a withdrawal of life support, or to agree to a DNR, do not resuscitate, or NFR, not for resuscitation order. Families of critically ill patients in intensive care who experience such a difficult, challenging and often traumatic situation don't see it coming, and they're usually taken aback and shocked by what the intensive care team is presenting to them. They are shocked to find that intensive care teams often don't have the best interest of their critically ill loved one at heart. When I get phone calls and emails from distressed family members regarding the intensive care team pressuring them to agree to a withdrawal of treatment, a limitation, or a withdrawal of life support, or they feel pressured to agree to a DNR, do not resuscitate, or to an NFR, not for resuscitation order. They can't believe that this is happening right in front of their very eyes. They feel like they've got to sign the execution papers for one of their loved ones. That's cruel and inhumane, and yet it's reality, even though we are living in the 21st century. And what's even worse, intensive care teams most of the time try and quote-unquote sell you on a withdrawal of treatment, a withdrawal of life support, as well as DNR, do not resuscitate, and NFR, not for resuscitation orders, as being quote-unquote in the best interest for your critically ill loved one. That's at least how I felt in many situations when working as a bedside nurse in intensive care, when senior doctors asked me to withdraw treatment or withdraw life support on a critically ill patient. And I have made very clear to them that I wouldn't follow their orders unless I knew that the family was on board with this decision, and unless I knew a transparent and amicable process had been followed, which is what rarely happens in those situations in intensive care. The good news is that families of critically ill patients in intensive care have way more power than they think they have if they follow expert advice and guidance. Again, usually when I get phone calls or emails from distressed family members who feel pressured by the intensive care team to agree to a withdrawal of treatment, a withdrawal of life support, or to agree to a DNR, do not resuscitate, or NFR, not for resuscitation order, the first question I ask them is if they are dealing with a real or a perceived end-of-life situation. Most families of critically ill patients in intensive care are baffled and shocked by me asking this question, and they often have to think for a minute. Once they understand that there is a difference between a real and perceived end-of-life situation, that's when they can take the first steps to get into an empowered state. I have written an article and made a video about the difference between real and perceived end-of-life situations when your loved one is critically ill in intensive care. You can check out this article and the video if you're clicking on the link in the written version of this blog below this video. Once families of critically ill patients in intensive care understand the difference between a real and perceived end-of-life situation, I often hear things like, "You are the only sane voice in this mess," or "Thank you, Patrick, for explaining the difference." How do I know the difference? Well, after more than 15 years intensive care nursing in 3 different countries, where I literally worked with thousands of critically ill patients and their families, and where I have been actively involved in hundreds of real and perceived end-of-life situations in intensive care, I think I have a real duty to share with you the lessons that I have learned. I have also worked as a nurse unit manager in intensive care for more than 5 years, and I have been managing again many real and perceived end-of-life situations in this role. I'm also now managing many real and perceived end-of-life situations in my one-on-one counseling and consultancy practice here at intensivecarehotline.com, and help my clients to make informed decisions, get peace of mind, control, power and influence in those difficult situations. The fact of the matter is that you and your family need to know and understand the difference between real and perceived end-of-life situations in intensive care, no matter what. You and your family need to know that you can have the ability, the capabilities, the resources, as well as the know-how at hand if you want to reverse a withdrawal of treatment, a limitation or a withdrawal of life support situation, or if you want to reverse, a DNR, do not resuscitate, or NFR, not for resuscitation order. The fact of the matter is that you want to be in control of your critically ill loved one's fate and destiny. It's non-negotiable. Over the last few weeks, I have been in quite a few family meetings in intensive care with my clients, and as with most of my clients, I get results really fast in order to help my clients get the outcomes that they want. In both cases, my clients' family members had been critically ill in intensive care, and in both cases the intensive care team tried to pressure the families to withdraw treatment on my clients' critically ill loved ones. Both families felt like they were now too far outside of their comfort zone, and they also felt that their loved ones were nowhere near of dying. With both clients, I was able to very quickly get to the bottom of things, and I found through my questioning that both intensive care teams had made irresponsible decisions leading up to a withdrawal of treatment as well as issuing a DNR order. Through a series of questions put forward to the intensive care team, we were able to successfully challenge the intensive care team's withdrawal of treatment and DNR, do not resuscitate order positioning. If anything, I helped both families to have their own strong positioning that helped them to get what they wanted. This is clearly what happens when you are seeking expert advice from someone like me who knows intensive care inside out and on an intimate level. It's all about looking at the details, looking at the things that the intensive care team is trying to hide from you, that I know for a fact they are hiding because I have seen it over and over again. But even if you don't want to engage me on a one-on-one phone of personal counseling and consulting level, I have still found a way to help you and your family to get what you want really quickly in a situation where the intensive care team is trying to coerce you and your family to agree to withdrawal of treatment, limit or withdraw life support, or to agree to a DNR, do not resuscitate, or NFR, not for resuscitation order. I have written an ebook that comes with 2 videos and 2 audio recordings, and in the ebook you get all the information you need to challenge the intensive care team when it comes to withdrawal of treatment, a limitation of treatment, a withdrawal of life support, as well as DNR, do not resuscitate, and NFR, not for resuscitation orders. In the ebook, the 2 videos and the 2 audio recordings, you'll get like a toolkit or a cheat sheet to master this challenge when your critically ill loved one is threatened with the withdrawal of treatment, a limitation of treatment, a withdrawal of life support, as well as DNR, do not resuscitate, and NFR, not for resuscitation orders. In the ebook, the 2 videos and the audio recordings, the 5 things you need to know if the medical team in intensive care wants to limit treatment, wants to withdraw treatment, withdraw life support, or wants to issue a DNR or NFR order for your critically ill loved one. You'll get all the information that you need in order to successfully challenge and reverse a withdrawal of treatment, a withdrawal or limitation of life support, as well as DNR, do not resuscitate, and NFR, not for resuscitation orders. It's tailor-made and easy to use information for you, written and spoken in a language that you speak and understand. In order to make this really easy and effortless for you, so that you can purchase this ebook that comes with 2 videos and 2 audio recordings risk-free, I have made this really easy for you, and I have made this virtually risk-free for you. You basically have 2 weeks to try this ebook, the 2 videos and the 2 audio recordings out for free. I take all the risk, but I'm so confident that this ebook, the 2 videos and the 2 audio recordings will help you very quickly to not only challenge but also help you reverse withdrawal of treatment, withdrawal and limitation of life support orders, as well as DNR and NFR orders. That's how confident I am in the information, the knowledge and the level of expertise that I can provide for you, for your family and for your critically ill loved one. So check it out, the 5 things you need to know if the medical team in intensive care wants to limit treatment, wants to withdraw treatment, withdraw life support, or wants to issue a DNR or NFR order for your critically ill loved one. You can check it out 2 weeks for free. I take the risk, and you can try it out and get results in the meantime. You can find the link to the ebook below this video in the written version of the blog. So, how can you become the best advocate for your critically ill loved one, make informed decisions, get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power and influence when you download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free Instant Impact Report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free Instant Impact Report now by entering your email below. In your free Instant Impact Report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power and influence in your situation. You'll get real-world examples that you can easily adapt to your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care, and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's blog, and I'll see you again next week in another update. Make sure you also check out our Your Questions Answered section, where I answer your questions, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on our contacts tab. Also, check out our ebook section, where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype or over the phone and via email by clicking on the email and phone counseling tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.